welcome doctors. So starting with the morphology of fatty liver disease. So what is fatty liver disease? Fatty liver disease means whenever there is a accumulation of fats within the liver. So as a result of this fat accumulation, it converts into fatty globule, that is called as fatty liver diseases. So here, say if this is a liver, so there will be fatty accumulation in the liver. As a result of this fatty accumulation, it will convert into fatty globule. So we call those diseases as fatty liver diseases. So there are two types of fatty liver diseases. That is alcoholic fatty liver disease and non-alcoholic fatty liver diseases. So alcoholic fatty liver diseases occur due to consumption of alcohol, while non-alcoholic fatty liver disease, it occur not due to alcohol. It is more associated with the obese. We will be discussing alcoholic fatty liver disease and non-alcoholic fatty liver diseases and successive series of lecture, but till now we will be discussing just the morphology of fatty liver disease. And remember students, this morphology of fatty liver disease, it will be same for the alcoholic fatty liver disease and non-alcoholic fatty liver disease. So starting with the morphology of fatty liver disease, so there are three patterns seen in the morphology, that is hepatocellular steatosis. The first phase is hepatocellular steatosis, and the second one is steatohepatitis, and the third one is Steatofibrosis. So, in the morphology of fatty liver disease, you will able to see hepatocellular steatosis, steatohepatitis, and steatofibrosis. So what does steatosis mean? Steatosis means whenever there is fatty accumulation in the liver, we generally term as steatosis. So that is nothing but that is the fatty accumulation within the hepatocytes. So starting with the hepatocellular steatosis. So in the hepatocellular steatosis, say if this is a hepatocytes and this is the nucleus. So here the fatty accumulation occur. There are fatty accumulation occur. As a result of this, it converts into fatty globule. So here there is accumulation of fatty cells or fatty globules, but they are not associated with the infection. While talking about the steatohepatitis, and steatohepatitis, there is also, if this is hepatocytes, that is the nucleus of the hepatocytes, so there will be fatty globules in the hepatocytes. But this fatty globule, with the progression of time, it increases further to such extent that it pushes the nucleus at the side. So that's the reason it occupies the larger surface of area, and it leads to the necrosis of the cell and all these kind of things. So it ultimately leads to the infection or inflammation. So the point is that the only difference between the hepatocellular steatosis and steatohepatitis is that here the fatty accumulation occur, but they are not associated with inflammatory reaction. While talking about the steatohepatitis, as it is implied here that there will be inflammation. So here the fatty accumulation occur, but along with that there will be, yes, inflammation occur. But while talking about the steatofibrosis, the unresolved state of steatohepatitis will lead to the steatofibrosis. So in this phase there will be repeatedly scarring and fibrosis. So we will be discussing now each of this pattern in detail. Now, starting with the hepatocellular steatosis. So as I told you that what is hepatocellular steatosis, and hepatocellular steatosis, there are fatty accumulation within the hepatocytes, that is liver cell. Say this is a hepatocytes. So in the center there will be the nucleus of hepatocytes, and when there is accumulation of the fat cell, say that is fat cell accumulation. When the fat cell get accumulated in the hepatocyte, it convert into fatty globule. So in the phase of hepatocellular steatosis, there will be the accumulation of fatty cell within the hepatocytes. Now it is divided into two further patterns, that is micronodular type and macronodular type. Micronodular type is also called microvesicular type, and macronodular type, it is also called macrovesicular type. And the micronodular hepatocellular steatosis, what actually happened? In the micronodular phase, if whenever the fatty cell get accumulated in the hepatocyte, so it do not disrupt and it do not displace the normal position of the nucleus of the hepatocytes. So that phase is called macronodular phase of hepatocellular steatosis. While talking about the macronodular hepatocellular steatosis, and this phase when the fatty cell get accumulated within the hepatocyte, so with the progression of time, this fatty globule, it increases in their size further. It increases in its size further, and its size get increases with the passage of time, and a state will come that it will push this nucleus in the periphery. It will push this nucleus in the periphery. Now in this phase, the nucleus is not placed in the center, instead of it is more located at the periphery. So in this phase we call that condition as macronodular hepatocellular steatosis. So at the basis of the nucleus displacement, we divide this pattern into further, that is macronodular pattern and macronodular pattern. So it is worth noting, in the macronodular pattern, the fatty cell get accumulated within the hepatocyte, but it do not displace the position of the nucleus. And macronodular type, fatty cell get accumulated within the hepatocyte, it increases its size and further with the passage of time, and it push the nucleus at the periphery. So that is the macronodular type of hepatocellular steatosis. And the macronodular and the hepatocellular steatosis, it is completely reversible if a patient stop taking alcohol. Remember students, this is very important point, that in the phase of hepatocellular steatosis, it is completely reversible if a patient stop taking alcohol. Remember this point. And the second thing is that if we see grossly, in the phase of hepatocellular steatosis, if we see the liver grossly, so what changes you will be found? So the liver will be here. If we see grossly, the liver is enlarged. And its weight increases further, and it will be yellow, greasy and soft. So if you see grossly in the phase of hepatocellular steatosis, you will find the liver is enlarged, its weight is increased further, and it is yellow. As you know that normally the color of liver is dark brown. So here the color of liver is yellow, that will be greasy and soft. So students, that's all about the hepatocellular steatosis. Now talking about the steatohepatitis. Now in the steatohepatitis, I already told you that there will be also accumulation of the fat cell. Say this is a liver cell and hepatocytes. Say this is a liver cell or hepatocytes. So in the center there will be nucleus, and whenever there is fat get accumulated, say this is fat, when the fatty cell get accumulated, so as a result of this fat accumulation, it will form a fatty globule. Now in the steatohepatitis, what actually occur? So with the passage of time, this fatty globule that is present within the hepatocyte, its size increases further. Its size increases further to such extent that it pushed this nucleus that is located in the center, it pushed this nucleus in the periphery. It pushed this nucleus that is located in the center to the periphery. So a stage will come that this fatty globule, it enlarged so much that it covered the largest surface of the hepatocytes. Whenever this fatty globule covers the largest surface of hepatocytes, so it means the hepatocyte is now unable to perform their normal function. So we can say that this cell of liver or hepatocyte, it is unable to perform its proper function. So we can say cell lead to death. There are death of cell, or we can say there are cell necrosis. So there are cell necrosis of liver, and as a result of this sudden cell death, it lead to the inflammation. And that's what actually I told you previously, that what's the main difference you will be found in the pattern of steatohepatitis and hepatocellular steatosis, that in this phase there will be also accumulation of the fat cell, but they will be associated with the inflammation. But in this phase of the steatosis, there is fatty accumulation occur, but they are not associated with the inflammation. Now this steatohepatitis, it is further, there are three patterns seen in it. That is the first phase, that is hepatocyte swelling or hepatocyte ballooning, and there is miliary dung bodies and there is neutrophilic infiltrate. So there are three patterns is seen in the phase of steatohepatitis. So that is hepatocyte swelling, that is mammary-dung bodies, and that is neutrophilic infiltrate. Now in the hepatocyte swelling, what actually happened, let's say if this is a hepatocyte normal size. Say this is a normal size of hepatocyte. So in this phase, this hepatocyte, it gets swell and it increases in size. So whenever the cell size get increases, so all the mitochondria, all the cell organelle in the form of mitochondria, in the form of endoplasmic reticulum, and a lot of ribosomes, they are start getting degradation. So they are start getting breakdown. So whenever these all cell organelle are start breakdown, so in a similar fashion, there is one another special organelle. It is located just below the cell membrane. So it also start getting degenerated. When it start getting degenerated, so what happens that it take the pink stain and convert into the aggregation. So there are aggregated, the degenerated component, it forms an aggregation, and that aggregation is called mammary-dung bodies. So what is mammary-dung bodies? It is nothing but it is the tangle skin of intermediate filament. This special organelle that is present just below the cell membrane, that is called intermediate filament. That is called intermediate filament. It is a supporting filament. It is present below the cell membrane. So when the hepatocyte increase in size, so what happened that all cell organelle start getting degenerated. So along with that, there are special organelle by name that is called intermediate filament, that is located just below the cell membrane. It also getting start degenerated. When it start getting degenerated, it taken the pink stain and convert into pink type of aggregation, that is called mammary-dung bodies. Hopefully students, you are getting up till now. Now in another third pattern, you will be able to see neutrophilic infiltrate. As it is an acute infection, and it is an acute infection, so there should be a neutrophilic infiltration occur. So in the steatohepatitis, there are three patterns, that is hepatocyte swelling or ballooning out, and mammary-dung bodies, and that is neutrophilic infiltrate. Now that is steatohepatitis. Now if you see grossly in the phase of steatohepatitis, so you will find that liver will be, there are some spots present on the liver. Say if this is a liver, so in the liver you will be seeing that there are some sort of spots present on the liver, and you can easily appreciate this structure, and that it means that the liver is mottled. So in the grossly you can easily see this structure, that means the liver is mottled. Liver is mottled. So student, that's all about the steatohepatitis. Now coming toward the last pattern of the morphology of the fatty liver disease, that is Steatofibrosis. Now, what is Steatofibrosis? Steatofibrosis is the last phase in the morphology, and whenever the steatohepatitis phase is unresolved, so this unresolved pattern of the steatohepatitis can lead to the Steatofibrosis. This steatohepatitis, when it unresolved, it can lead to the steatofibrosis. So in the phase of steatofibrosis, there will be repeatedly episodes of scarring and fibrosis. Now the question is, where this fibrosis start in the liver? So remember students, this repeatedly episode of scarring and fibrosis, it start from the centrilobular area. Centrilobular area. Now what is centrilobular area? As we discussed earlier, say this is a hepatic lobule, so this is another hepatic lobule. Now, in the center, there will be hepatic vein, and the periphery there will be portatrix or hepatic triad. Now, this repeatedly episode of scarring and fibrosis, it starts from centrilobular area. Now, where this area is, around this hepatic vein, there is an area that around the hepatic vein, that area is called centrilobular area. It means repeatedly episode of scarring in fibrosis is start from centrilobular area, and there are, as you know, that there are multiple row of hepatocytes is present in between the portal tracts and the hepatic triad. So these are multiple row of hepatocytes. So whenever the fibrosis starts from the centrilobular area, then from the sides of this hepatocytes it moves downward. When it moves downward, so ultimately it moves up to the portal tracts, and from the portal tracts it goes into the another lobule and it involves another lobule. So in a short, we can say centrilobular area getting started from the centrilobular, from around the hepatic vein, and then from the sides of these hepatocytes, it moves downward and ultimately it reaches to the portal tracts. And from the portal tracts, it can involve the rest of lobules as well. Okay. Now, this pattern that is starting from the hepatic vein to the portal tracts, this pattern that of fibrosis is called chicken wire fins pattern. Chicken wire fins pattern. This is very important, don't forget this point. What is chicken wire fins pattern? Chicken wire fins pattern means that whenever the fibrosis starts from the around the hepatic vein, then it moves to the side of hepatocytes and the space of this, and then it moves into the portal tract, and from the portal tract it can involve another lobule as well. This whole pattern is called chicken wire fins pattern. There are two important terminologies that is mentioned in the book, that is LAENNEC cirrhosis, and another one is CRYPTOGENIC cirrhosis. CRYPTOGENIC cirrhosis. So LAENNEC cirrhosis means that whenever scarring and fibrosis involve the lobule, so what happens as a result of this scarring, the lobules get contracted, and it can lead to the phase of there are nodular pattern is developed in the hepatic lobule. And as you are very familiar about it, whenever there is nodular pattern appear in the liver, so we can say that's the phase of cirrhosis. So in the LAENNEC cirrhosis, there are tough scar tissue formation occur in the hepatic lobule due to the repeatedly episode of scarring and fibrosis. And the most important point is that this LAENNEC cirrhosis, it is associated with the alcoholic fatty liver diseases. And if we talk about CRYPTOGENIC cirrhosis, it is associated with the non-alcoholic fatty liver disease. It is very important. I'll repeat it once again. This LAENNEC cirrhosis, it is associated with the alcoholic fatty liver disease, while CRYPTOGENIC cirrhosis, it is associated with the non-alcoholic fatty liver disease. And CRYPTOGENIC cirrhosis is the most dangerous form of the liver disease, where the liver is completely destroyed, even there are devoid of fatty tissues, and the liver is completely shrunken and completely disrupted. So that is CRYPTOGENIC cirrhosis. Hopefully students, you are getting till now. That's all about the morphology of fatty liver disease. Thank you so much.